Long-term survival benefits and disease stabilization with acoramidis in patients with transthyretin amyloid cardiomyopathy. ATTR cardiomyopathy, if untreated, leads to progressive heart failure and death. Acoramidis is a small molecule stabilizer of transthyretin for use in patients with TTR amyloidosis. Similar to the previously developed tafamidis, acoramidis is used to stabilize TTR in its tetrameric form, preventing the formation of amyloidogenic monomers and the progression of amyloidosis. Its efficacy was established in the randomized phase 3 ATTRibute-CM study, where acoramidis treatment, compared to placebo, significantly reduced the risk of all-cause mortality and cardiovascular hospitalization at month 30. This is the long-term efficacy and safety of acoramidis through month 54 of the ATTRibute-CM and its open-label extension study. ATTRibute-CM randomized patients with symptomatic ATTR cardiomyopathy to acoramidis or placebo in a 2-to-1 ratio. The randomized phase lasted 30 months, during which tafamidis usage was allowed after month 12. At the end of the randomization, patients were invited to enroll in the open-label extension phase. 389 patients enrolled in the open-label extension phase. Patients who received active drug during the randomized phase continued on active drug, called the continuous acoramidis group. Patients who received placebo during the 30-month of randomization but then transitioned to acoramidis is called the placebo to acoramidis group. Importantly, during the open-label extension, concomitant tafamidis therapy was not allowed. These are the patient characteristics in the open-label extension. Patients in the placebo to acoramidis therapy had more advanced disease than the continuous acoramidis group, as evidenced by the prevalence of NYJ class 3, measurements of 6-minute walk distance, NT-proBNP, serum TTR, and the KCCQ score. As you can see here, early and continuous acoramidis resulted in a hazard ratio of 0.55, which was highly significant, and translated to a risk reduction of 45% in the risk of all-cause mortality at month 54. A similar analysis of cardiovascular mortality also showed a highly significant risk reduction of 49% at month 54. Treatment effect on both all-cause mortality and cardiovascular mortality showed consistent directionality across key demographic and clinical subgroups. There was no heterogeneity of effect. So looking at the summary of the effect of acoramidis on all-cause and cardiovascular mortality, at the end of 30 months of the randomized trial, the drug directly reduced the risk of all-cause mortality and cardiovascular mortality by 23 and 29% respectively. In the open-label extension phase, early institution and continued acoramidis therapy compared to the placebo to acoramidis group reduced the risk of all-cause mortality and cardiovascular mortality at 36% and 45% at month 42. With further follow-up at month 54, there was a sustained and incremental benefit on all-cause mortality and cardiovascular mortality of 45% and 49% respectively. These are the data on BNP. As you can see here, early and continuous acoramidis stabilized NT-proBNP compared to the placebo to acoramidis group. These are the data on serum TTR, which we now know is associated with prognosis. There is a sustained increase in TTR with acoramidis therapy. Notably, in patients who went from placebo to acoramidis after the institution of therapy, there was the expected increase in TTR, but the magnitude of the increase was lower than that compared to the early acoramidis group. There continues to be well-balanced adverse events between groups, with no additional safety signals noticed during this extended follow-up period. In summary, early and continued acoramidis treatment provided durable reductions in all-cause mortality and cardiovascular mortality through month 54. There was no heterogeneity of this effect across key patient, demographic, and clinical subgroups. Early and continuous acoramidis stabilized important biomarkers through month 54, and acoramidis was very well tolerated during this extended follow-up period.